Welcome to the ASM webinar today, translating the alphabet soup of clinical laboratories. Thank you for joining us. My name is Dr. Ph.D, and I am the Associate Director of Infectious Disease Testing at Montefiore Medical Center, and I will be introducing today's speaker, Dr. Nicholas Moore. Dr. Nicholas Moore is an Associate Professor at Rush University and is the Associate Director of the Division of Clinical Microbiology, Department of Pathology, and Director of the Biocontainment Laboratory at Rush University Medical Center. Dr. Moore is board certified in medical and public health microbiology. His research focuses on the epidemiology of multiple drug-resistant organisms, antiseptic, and biocide resistance in gram-negative bacilli, and the use of advanced molecular diagnostics to inform infection control decision-making related to nosocomial outbreaks. Dr. Moore is also president-elect of the Illinois Society of Microbiology, a volunteer with ASM and CLSI, and a member of the College of American Pathologists Microbiology Committee. So before I turn over the mic to Dr. Moore, there's a couple of housekeeping items. There's a chat box on the right-hand side of your screen. So to submit a question, type your question in the small text box at the bottom. So with that, well, take it away, Dr. Moore.
Thank you all so much. Just want to confirm that that my slides are coming through and that everyone online can see them.
You can see it. Yes.
Awesome, great. Well, I do want to, thank ASM for the invitation to present on this really important topic, and thank all of you for taking time out of your busy days to come and listen. I do have my disclosures here that were shared, as well as the learning objectives for this talk. And I really wanted to just start by introducing laboratory regulations as a framework for really for all of the aspects of this talk. And the reason why laboratories are so complex is really for a number of reasons. The first being, of course, is that the type of testing that is performed, this is not testing that's done in like a research laboratory to answer a scientific question or to explore or test a hypothesis, but the results that are generated in clinical laboratories are used for providing patient care and helping to aid in diagnoses or monitoring health conditions. So there's a direct impact in human health. And again, we're typically serving, a broad population, and these are, the patients who are seeking care at a number of healthcare facilities, whether it's at a hospital, in a ambulatory clinic or a physician office, and a variety of other sites. And then the personnel who are employed by clinical laboratories have to meet certain qualifications in order to perform that testing and to ensure that the laboratory is generating accurate results. And a lot of the approaches that are used in clinical laboratories to cover all of these different facets are, again, really to assure safety, reliability, and quality so that our clinician colleagues who are providing care to these patients can trust in the results that they're receiving from the laboratory who is doing said testing. So I want to just start really about, just as an overview or framework about the role of clinical laboratories specific to how they operate here in the United States. So you might think, what is a clinical laboratory? What do they look like? Just going from left to right on these pictures, you can see like early on clinical laboratories were probably very low tech. There was a lot more manual testing that was done in all areas of the clinical laboratory. Whereas if you move across the images, you can see, more still manual processes, but now, especially, in the last 20 years or so, the introduction of a lot of automation to facilitate just the sheer volume of samples that clinical laboratories are receiving on a daily basis. And that's not to say that all areas of the laboratory are automated. The clinical microbiology laboratory is one example where automation has really not been around as frequently to the degree that it has been in other areas of the clinical laboratories like the chemistry or hematology laboratory. But that's automation is making it is appearing in clinical micro laboratories. But there is still a lot of manual work in automation rather than automation. And this manual work often requires a lot of interpretation by the performing medical laboratory scientist or medical technologist, is the term that a lot of laboratory professionals were previously identified as. These can be, again, not just focusing on the micro lab, but these can be to identify abnormal cells, like in this picture on the upper left, we're looking at a right stained peripheral blood smear showing an increased number of blast cells in the peripheral blood, which is, a marker of badness, so to speak. Blasts typically do not should not be present in the peripheral blood. So this can be a marker of an acute leukemia in a patient. There's a lot of manual steps in clinical micro, and the immunohematology or blood bank lab is another area where there's a lot more manual testing that is done rather than relying on automation. And in the micro lab, since this is an ASM talk, a lot of what we do has to deals with the identification of microbial pathogens from clinical specimens. So in the lower right, you can see a gram-stained slide from a blood culture that was collected that turned positive on a patient. So we can see numerous, gram-negative bacilli here. And the gram stain is often still the first step that is done in micro labs to begin like a diagnostic workup when a pathogen is detected. So laboratories, as I said, are complex, and there's a lot of verbiage or words that you hear every day in clinical laboratories. And some these words have specific meaning within the setting of a clinical laboratory. But if you were to talk about some of these things outside of a laboratory, some of them may sound very similar to one another, but there are a lot of subtle differences in what some of these terms mean, like calibration versus validation and verification, and so forth. So understanding kind of the lingo are things that you learn in laboratory science training programs, and learning how to be compliant with all of the regulatory and or accreditation requirements that are set forth that clinical labs have to abide by in order to function and operate. And that really leads us directly into the laws in the United States surrounding clinical laboratories. So the Clinical and Laboratory Improvement Amendment, also known as CLIA, was passed by the US government in 1967. And this is really where, at a federal level, the first regulations were established to set some basic standards on how clinical laboratories should operate in the United States. And largely, these regulations were focusing on laboratories that tested human specimens, but were really focusing on and applied only to laboratories that engaged in interstate commerce. So specimens leaving one state really and going to another, where they would ultimately be tested. So if your collection site is different and crosses state lines, in the initial version of CLIA, these regulations applied. And what CLIA also did was establish a very specific definition on what the federal government identifies or considers a clinical laboratory. And that is a laboratory that performs any type of testing of materials derived from the human body for the purpose of providing information for the diagnosis, prevention, or treatment of any disease. So a very specific focus on what clinical laboratories are doing. As CLIA was first ratified in 1967, by the late 70s and early 80s, there were several reports that were coming out in the popular media and the press regarding the concern for inaccurate laboratory results. And this is an example out of the archives of a story of an opinion piece published in the Washington Post in 1988. And I just want to draw your attention to some of the highlighted portions here. Is that this was an investigative series of reporting that uncovered laboratory mistakes that resulted in preventable cancer deaths, as well as the patients receiving unnecessary treatment for non-existent illnesses. And really what boiled down, a lot of this was around pap smear screening for cervical specimens looking for abnormal cells or cervical cancer. And some laboratories had established quotas expecting their laboratory personnel to screen and read upwards of 300 pap smear slides per day. And also equally disturbing was that testing that was being performed in some laboratories located in physician offices were being performed by people without the necessary training involved. So that led to revisions to the CLIA law, which was amended in 1988. And the two main changes here were really that this now accounted for federal establishing requirements at a federal level for all clinical laboratories of all facility types. So no longer focusing just on those engaged in interstate commerce. And they also, or CLIA also developed and improved quality standards related to laboratory testing. And they really were focusing on three domains, if you will, and that's accuracy, reliability, and then the timeliness of these test results. Now, the CLIA law has been amended a few additional times, both in 1997 and 2012, but it's still commonly referred to as CLIA 88 if you hear it mentioned kind of within the realm of clinical laboratory space or by CMS. These amendments were not really focused on large, big picture changes, but on just additional enhancements. So again, CLIA 88 also looked at all aspects of laboratory testing, not just focusing on the analytic portion, but also looking at the pre-analytic. So how specimens are collected, how they're handled, how they're transported, kind of focuses on that pre-analytic phase, as well as focusing on the post-analytic. So after the testing has largely been completed, focusing on the reporting aspects or additional interpretation that's done by laboratory personnel. And all of this was around the goal of providing systematic improvements in the quality of laboratory practice that's engaged here. There's been lots of stories, unfortunately, in the media, and I think many people may recognize this cover of Elizabeth Holmes, who probably one of the most infamous people of our time. She was a college sophomore dropout, founded her own with the goal of founding her own diagnostics company, Theranos, and their goal was to really ultimately provide laboratory test results from pinprick drops and amounts of blood, and this was as a Silicon Valley essentially startup. It's a really interesting timeline. If you read some of the investigative pieces, this has been dramatized in film and a television miniseries. But ultimately, over-promising and failing to deliver on her goal of providing laboratory results, or her company providing laboratory results with a minute amount of blood, but also found to be engaging in inappropriate practices while owning and operating a clinical laboratory that was providing results to physicians to provide care for their patients. So, both her and her the chief operating officer, Sunny Balwani, their trials were and convictions were really applauded, I think, by many in the clinical laboratory community for the egregiousness of their crimes, even though the crimes that they were ultimately convicted of had nothing to do with or were not related to bad clinical laboratory data. It was really more securities fraud and defrauding investors. but still worth just kind of mentioning how serious laboratory testing is. And there are a lot more examples of more recent cases as a result of the SARS-CoV-2 pandemic, where these clinical laboratories or testing sites were popping up seemingly overnight, promising and offering testing when testing capacity was very largely unavailable just due to the sheer volume and the impact globally of the SARS-CoV-2 pandemic. And this has, resulted in a lot of, high-profile cases brought forth in multiple jurisdictions across the country, and probably somewhat also, outside of the United States as well. So the clinical, I say all of this to just really emphasize how vital and how important clinical laboratories are in healthcare in general, and how we need to be especially cognizant of that as scientists and laboratory professionals. And here in the United States, there are 3 federal organizations that are really responsible for enforcing the regulations that are set forth in the CLIA law as it relates to laboratory testing. So, and those are CMS, the Centers for Medicare and Medicaid Services, the CDC, or Centers for Disease Control and Prevention, and the Food and Drug Administration. And you can see in this table kind of what each of these different organizations are responsible for in terms of their role in enforcing CLIA law. As it relates directly to clinical laboratories, for the most part, we focus on the role of CMS. CMS is the federal agency that is responsible for ensuring that the CLIA standards that are outlined in that legislation are upheld as well as enforced by clinical laboratories. And they're also responsible for managing the CLIA program for the government, and they are responsible for issuing CLIA certificates and collecting the fees that are used to operate the program. They also approve laboratory accreditation programs, so external organizations that accredit clinical laboratories for being in compliance with the CLIA law, as well as monitor proficiency testing programs. And participation in a proficiency testing program is a required standard under CLIA that all clinical laboratories have to participate in. And I'll skip the role of CDC and FDA, but you can kind of see what those are here. So I talked mostly about clinical laboratory testing, but there are also tests that are performed for research purposes, and there are also research tests that are tests that are performed for research purposes in clinical laboratories. And it's important to note that the CLIA regulations do not really differentiate between facilities that are performing provider or clinician ordered testing and those that are performing non-provider ordered testing. Any facility that meets the definition of a laboratory under that CLIA statute and those regulations are required to obtain an appropriate CLIA certificate before conducting any patient testing. And to do so without obtaining a CLIA certificate is a violation of the law. And it's also important to note that there are laboratories that perform testing on human specimens who do not report an individual or a patient-specific result. Those laboratories may qualify for an exception from CLIA certification. And this was a little bit of a nuanced distinction with the SARS-CoV-2 pandemic for laboratories that were performing population-based surveillance testing, where specimens were collected, but there were no patients' specimens were de-identified, and they were testing things either through nucleic acid amplification or serology, and these results were generated at a population level, but could not be directly linked back to any one individual person or patient. Laboratories like that would be exempt from CLIA because there are no direct identifiers on a specimen. So how big is the CLIA program? Well, it's always in flux because laboratories do open and close and receive different CLIA statuses. But right now there are approximately 320,000 laboratories in the United States that are registered with CLIA. And you can see kind of the breakdown really the growth by their CLIA certificate type, and I'll talk about those different types briefly in a moment. where we've more than doubled the number of CLIA certified laboratories since the CLIA program began officially in 1993. So from 152,000 to over 320,000. And I'll point out the different colored bars in this graph represent the different types of CLIA certificates that a laboratory can apply for based on their type of testing. And we see the largest amount of growth in this dark blue shaded bar. So from 67,000 to 245,000 laboratories with a CLIA certificate of waiver. These are laboratories that are performing very simple testing, and they have known as waived testing. And this represents the largest increase out of all of the types of laboratories overall. Now, there are two states, both the state of New York and Washington, that are exempt from the CLIA program because their individual states have their own regulated laboratory programs that are more stringent, that meet the requirements and are more stringent than the CLIA federal regulations. These laboratories do register with CLIA and have CLIA certificates, but their individual states oversee the operation of their programs. So why are there so many different CLIA certificate options that I showed you, and of those different four? And they really relate to the type and complexity of the testing that is being performed. So again, those laboratories that function with a certificate of waiver are performing CLIA waive tests. And these are tests that by definition are very simple and have a low risk for erroneous results. So a perfect example of this would be, checking the blood sugar of a patient using a point of care glucose device in a hospital or clinic setting. There's also a certificate of provider performed microscopy services. This is a limited menu of tests that are performed by microscopy that's performed by the provider directly rather than often a laboratory personnel. And a classic example of this from a microbiologic standpoint would be examining a slide looking for pinworm from the pinworm ova or adult worms in case of suspected pinworm infection. The last two are certificates of compliance or certificates of accreditation, and they're really, for the most part, identical in terms of their the scope of services. These laboratories are able to perform both moderate and high complexity testing, as well as testing that is categorized by any laboratory subspecialty. And really, it's just the type of program they apply to. So these would be laboratories that are, like a full service clinical microbiology laboratory where they're taking specimens, cultivating to look for growth of microorganisms, such as in these images here. You can see growth of a mold organism on the agar plate, and then microscopically working to identify what that mold is from a specimen. And this ended up being an isolate of Aspergillus fumigatus. So that's an example of high complexity testing. It requires cultivation of an organism and then identification by manual means, looking at the macroscopic and microscopic appearance, or utilizing sophisticated laboratory analyzers like a MALDI-TOF instrument, or identification of an organism through targeted DNA sequencing, for example. So one slide on the difference between CLIA compliance versus accreditation. Laboratories that have a CLIA certificate of compliance are laboratories that are surveyed directly by CMS or its agent, which is typically the regulatory arm of the state public health department where that laboratory that laboratory exists within that jurisdiction. So this is a direct survey by a government agent to determine regulatory compliance with those CLIA standards and requirements. CLIA certificates of accreditation are issued to laboratories who are surveyed by an external organization who demonstrate satisfaction at meeting the standards of an accreditation program approved by CMS. So CAP, the College of American Pathologists, is one of 7 organizations that have a laboratory accreditation program approved by CMS that laboratories can use in lieu of being surveyed directly by CMS or its agent. So about 5% of clinical laboratories in the United States overall are accredited by an organization with deemed status by CMS. So again, that's fitting in the certificate of accreditation box. And you can see here on the bar chart on the right what those 7 organizations are: CAP, COLA, Joint Commission, and a few others. So again, these are laboratories who receive their inspections to demonstrate compliance with CLIA standards by an external organization. These organizations have to have their accreditation program approved by CMS to demonstrate, again, that it's meeting those minimum standards at least. But oftentimes, not often, external organizations and who accredit laboratory programs have standards that go beyond those requirements that are set forth by CLIA. So they're much more stringent. There's also regulation versus accreditation in clinical laboratories. And again, this is where, nuance and definition of terms, I'm probably guilty of this myself, using these somewhat interchangeably when they really shouldn't be. But regulations really involve specific details by which a law is to be implemented. With respect to CLIA, this is published in the Federal Register. Again, this is a legally enforceable law, and it's required that all, with respect to CLIA, that laboratories meet and fulfill all the requirements of a regulation. With accreditation is an award to an entity, so a laboratory, and this really functions as a seal or an approval. It's I don't want to call it a rubber stamp, but it's demonstrating that you're meeting all of the requirements of the accreditation organization. And again, these are meeting again those minimum standards, but they often are really exceed those standards. Accreditation with respect to laboratories is really truly voluntary. I say that with kind of a parentheses, because now it's really important from a to be able to say, as you're for laboratories that want to go out and perform testing for other organizations, do outreach, that they demonstrate that they're a quality organization. So they often will go out and seek these accreditations because they're recognized by the recognized by the public for being able to meet and exceed these standards or these expectations. Similarly, this applies to other areas of healthcare, not just in clinical laboratories. But regulation and accreditation are really closely intertwined. So again, regulations are enforceable, and they're really to guarantee safety for patient care. And again, we're talking about setting those minimum standards. And accreditation exceeds those minimum standards that are set forth by CLIA. So that's really kind of pushing your organization or your laboratory to that next level, always trying to be to seek improvements and to reach for excellence. And clinical laboratories, regardless of whether they have a CLIA certificate of compliance or a certificate of accreditation, undergo biennial inspection surveys to demonstrate that they are compliant with all of those requirements that are set forth by CLIA, and any additional accreditation requirements that are applicable to that laboratory accreditation organization program. So that's really functioning about clinical laboratories. But now, how can you work in a clinical laboratory? So I often like to talk about what are the qualities that one should demonstrate or display to really work as a laboratory professional. I mean, I think first and foremost, there needs to be an interest in science. I mean, you're going into a very science-heavy profession, so hopefully you have an interest in that. I think it also helps to have a bit of an analytic mind, especially if you're going to be working with a lot of sophisticated analyzers and equipment. But even if you're doing much more manual work, like in a microbiology lab, having an appreciation and understanding of how those organisms grow and across different media, and being able to really think critically is really important. It's definitely important. You have to be detail oriented. especially when we're reviewing cultures, because sometimes there are a lot of subtleties that our really skilled laboratory professionals do pick up on. And even though you need to be able to work independently, of course, you have to be a team player, especially in healthcare settings. It's all about team care and providing the very best care for patients. So being able to work together is really, really important. And you should be able to get along with your colleagues and coworkers. The good news, it's a good news, bad news situation. Good news, there are vacancies across all disciplines of the laboratory, professional community, including, microbiology laboratories, which arguably, I'm biased, I think are the most exciting. This is a survey that's published every few years in the American Journal of Clinical Pathology, looking at vacancy rates across all disciplines. So about a 6.7% vacancy rate in microbiology, which has decreased somewhat compared to pre-pandemic years. So that just means there are jobs available for people who want them and who qualify for these positions across all laboratory disciplines. Also, what they keep track of are anticipated retirement rates over the next 5 years. So you can see retirement rates in microbiology, are expected to be about 15%. So lots of opportunity in the foreseeable future as well. And again, across all areas of the clinical laboratory. And this is a statistic from the Bureau of Labor Statistics and the Health Research Services Administration. So the projected demand for laboratory professionals overall is expected to increase 19% by the year 2030. So again, lots of opportunity for entry into this profession as a career. So how can you work in a clinical laboratory? Well, it's take your pick. There are a lot of what we refer to as routes to enter and to get into a clinical laboratory. They largely depend on your level of education and somewhat your location does play a factor. And we'll talk more about location in a little bit, but I would say there are 4 key things that one should really consider if you want to work in a clinical laboratory. And that's first, ideally one would graduate from an accredited training program with either a degree or as a post-baccalaureate program where you've with a concentration or a curriculum in medical laboratory science. And then obtaining certification from a nationally recognized certification agency as again, demonstration of your knowledge, skills, and abilities that you learned in your educational training program. Then apply to jobs and start working. And it's I say that like those are the 2 easiest things, but those are the basic 4 steps. Going back to CLIA though for a minute, the law does mandate personnel qualifications in order to qualify as testing personnel. So someone who's doing the work, on a laboratory bench, working up specimens or cultures and generating reports and releasing those reports. And so it's a requirement that the laboratory have a sufficient number of individuals who meet these qualifications. I'm not going to read this list. If you really want to read the CLIA law, it's about 250 or so pages, and it's driven up by different sections. The personnel is in subpart M, but ultimately point B points out that one needs to have a degree, either a doctoral degree like an MD, DO, DPM, or have a doctoral, master's, bachelor's degree in chemical, physical, biological, or clinical laboratory science from an accredited institution. There are opportunities for those people who have associate's degree and have education and training that includes a laundry list of requirements that one has to meet that I could not fit on the slide. But suffice it to say, the easiest route is to have a minimum of a bachelor's degree in a physical or biological science, or medical laboratory science as an undergraduate major. There are personnel requirements when it comes to for individuals to work in clinical laboratories. And there are CLIA also mandates personnel roles that that laboratories have to follow. So these can include roles of like laboratory director for a waived testing site, as well as then the testing personnel. And for non-wave testing, so a laboratory like my laboratory, we have to have, a laboratory director, number of different types of supervisors, and ultimately your testing personnel. And then there are also different requirements as it relates to the assessment of one's competency relative to the types of testing that is being performed, and how thorough that competency assessment is. So I know that in next month's webinar, so part 2 of this, there's going to be a more in-depth look at the different roles found within the laboratory. So I encourage everyone to attend that as well. So continuing on with personnel talks, I want to talk briefly about certification versus licensure and why that distinction is really important. Certification, again, is a credential that is awarded to a professional to validate really their knowledge, their skills, and their abilities. Certifications are awarded by non-government organizations, and certification is really voluntary. Even CLIA, though CLIA does not require certification, CLIA requires a degree and a license if a license is required to practice in the jurisdiction the laboratory resides in. But CLIA itself does not require certification. So certification in that aspect is voluntary by the individual. Certification is also revocable, and is not guaranteed to be, it's not a lifetime certification. They often require recertification efforts through demonstration of continuing education. Licensure, however, is a legal permit that is required for an individual to perform an occupation or engage in that occupation in a particular location. And licenses are issued by governments or agencies, and these are done at the state level. Licensure, if a state is a licensure state, then it is mandatory to have a license to engage in that occupation. Licenses, like certification, though, are revocable for reasons of malpractice, and to practice in a laboratory without a license, if it is required, is unlawful and can face civil and criminal penalties. With respect to certification, there are multiple agencies or organizations, that can certify laboratory professionals. The American Society for Clinical Pathology, or the ASCP BOC, is probably the most well-known or well-recognized credential for laboratory personnel, but there are others, including AAB, or the American Association of Bioanalysts, or the American Medical Technologists Organization. I'm going to focus, for example, and time's sake, just on ASCP. But within the laboratory, within the clinical laboratory, there are multiple certifications that an individual could apply for and earn that qualify them to work in a clinical laboratory. And these are grouped broadly into these buckets of these generalist certifications, where they have education and training and experience in all areas of the clinical laboratory, or there are categorical certifications, or where you're focusing on a defined area, like just being certified to work in a clinical microbiology lab or a blood bank lab, for example. Regardless of whether you have a generalist or a categorical certification, for those with additional years of experience, clinical laboratory work experience, and possibly or additional education, there are what they also refer to as specialty certifications. But a specialist certification requires one of the either generalist or categorical certifications as a prerequisite. So you may be wanting to think about, I want to apply for an ASCP, exam and take earn that credential, but I'm unsure how to apply for. You can visit ASCP's website. They have an examination eligibility assistant that's really quite easy to navigate, but it's ultimately up to the applicant or the person seeking the credential to review the requirements very carefully, determine which route is appropriate for you to apply under, and ultimately submit your application, study for the exam, take it, you pass, and then you've got that certification, and then you can, go out and apply for jobs. With respect to the MLS, which is the Medical Laboratory Scientist certification, which is their most high, one of their most high volume certifications that they award. There are really 6 different routes of eligibility, which I've listed here. You can review the ASCP's website to get that information. Route 1 is predominantly, I would say, the most common. This is where an individual has a baccalaureate degree from an accredited college or university program, and they successfully completed a NACLS accredited medical laboratory scientist program within the past 5 years. So NACLS is the organization, is a specialty accreditation program organization that accredits laboratory science training programs at the associate, undergraduate, and graduate level. So programs that have NACLS accreditation meet the standards in order to for their graduates to apply for certification under this particular route. An alternative would be to be certified as a medical laboratory technologist. That's the credential awarded to associate degree holders in medical laboratory technology, who maybe then go on to complete a baccalaureate degree in another program. You can see here they have to have a number of semester or quarter hours in different scientific disciplines, as well as 2 years of full-time acceptable clinical work experience. So that's working in a CLIA certified laboratory, and you're working in each of the different disciplines of a clinical laboratory. So blood bank, chemistry, heme, micro, immunology. And that experience all has to be documented within the past 5 years to sit through this route. There are a couple of other routes if you don't have certification, or if you do have an international certification. Again, they largely rely on either specific educational requirements and really some type of work experience that's required to sit for these routes. This last route is really for those individuals who complete a medical laboratory training course within one of the uniformed services of the U.S. military that's done within the last 10 years. Those individuals also have to have a baccalaureate degree and have to have 1 year of full-time acceptable experience. So I think one of the benefits is that there's a lot of ways to get to certification, but it also does make things a little complicated. And this is often a question that I've been asked by those who are interested is, what is the best route for one to take? And, really that's up to you to decide as an individual based on your own your background, what's happening kind of in your life and what you're able to do. So there are a lot of pathways, which is great, but it again does complicate things. So real quickly on licensure, there are states that do require laboratory professionals to obtain licenses in order to work. So there are 10 states, as well as Puerto Rico, that are listed here. And the licensure requirements across states are different. They are not uniform. I think it is the state of California that has the most stringent requirements when it comes to licensure, followed by New York. So it's very important for people who are interested in laboratory science and who want to relocate or return home to if their home state, if it's California or New York, to really visit those state board licensing requirements to make sure your educational program or your if you're going through if they allow you to have a work experience route, that you satisfy and meet all their requirements. Otherwise, you would not be able to work as a laboratory professional in that jurisdiction. One of the laboratory professional societies, ASCLS, has a lot of information or resources related to licensure in those states. And you can visit the URL here that's provided. So where can you get more information? ASM has really curated a lot of information for its members, for the public, for those who are interested in joining the clinical laboratory profession. You can check out their day in the life of a microbiology bench, which is which was really nice. There's also a list that is maintained of clinical and public health microbiology mentors. These are ASM members who are willing to have anyone reach out to them to answer questions, to learn about the routes or experiences. I've had people reach out, though I'm not a CPHM mentor, I've had other individuals, just in the Chicago area reach out to me. I've allowed people to come in and kind of like shadow for a day to really see what it is that goes on in a clinical laboratory. Certainly, I think the clinical laboratory world is a little more well known now as a result of the SARS-CoV-2 pandemic, and there just being a lot more awareness of clinical laboratory testing, but there are additional resources that are available, and I encourage everyone to use whatever's at your fingertips. ASM does have a one-pager on the different types of laboratories that you could work in, whether it's a clinical lab or a public health microbiology laboratory, two very different things, but are both, very highly, rewarding, careers and professions. So I want to leave plenty of time for questions. So really, so in summary, I think, takeaways from this are that, clinical laboratories are really highly regulated facilities that test a variety of materials derived, from the human body in order to provide information, again, for the diagnosis, treatment, and prevention of any type of disease. All clinical laboratories in the United States must follow CLIA regulations. There are no exceptions to that. If you are testing clinical specimens and providing results for direct patient care, you must follow the CLIA regulations. And to do so without following CLIA regulations or having a CLIA certificate is illegal. Laboratories must also demonstrate compliance with CLIA regulations, and they can do this. One option of doing this that's somewhat common is by obtaining an external accreditation from a CMS approved program. And again, there are also, as I discussed, requirements in terms of personnel, in terms of their training, education requirements that are established in order to perform testing. So these personnel have to meet these minimum educational standards. And certification of personnel really is voluntary. It's highly recommended, and I think it does give applicants or individuals who are applying for positions in clinical laboratories a leg up over their non-certified counterparts. But certification is voluntary, whereas licensure in states where laboratory licensure is required is a requirement in order to work in a clinical laboratory. So with that, that's all I had prepared, and I'd be happy to hear any questions from anyone online. Thank you.
Thank you so much, Dr. Moore, for such an amazing presentation, a very, very informative talk, and for breaking it down to, this very, complicated with all the terminologies and all the regulatory, all the layers after layers. It's just really complicated. And with that, actually, as a reminder, there is a text box at the bottom to type your question. So if you have any questions, please feel free to type your question. So we have first one question here. Someone asked, is ABMM by ASM not a certification too? So a person with ABMM needs other certifications apart from ABMM to become a laboratory director?
That is a great question. So ABMM, yes, the American Board of Medical Microbiology does offer a certification examination, and that is really to certify or credential those individuals who have either completed a fellowship training program or through work experience on the job training to be able to direct clinical, in this case, a clinical microbiology laboratory. It is ABMM is one of the 7 or 8, boards that are accepted by HHS to function as a CLIA laboratory director as well. So if you're not a physician, a pathologist, and you want to be a director, have your name on the CLIA certificate, you must be certified by one of the approved HHS boards. And ABMM or ASM as the body, the ABMM exam does qualify that individual. Now, whether or not an individual who's ABMM certified requires additional certification or requirements to function in the role, again, relies on the jurisdiction. So in Illinois is a non-licensure state. I'm using that as my example. So I don't require a license to be a laboratory director or to be a laboratory testing personnel, which was my past life as a medical laboratory scientist. If I was in the state of California, for example, where licensure is required, for testing personnel, but also for laboratory directors as well. So it does depend on the jurisdiction always. So I hope that answers that question.
So I guess a follow-up question is with the ABMM, will you still require a license to practice in California? So that
yes, they do.
Righty. All right, the next question we have is, are there pros, cons regarding which outside organization, CAP, COLA, etc., clinical laboratories are accredited through?
Are there pros and cons? So I can only speak to what I'm familiar with. So our laboratories here at Rush University Medical Center are accredited primarily by CAP, the College of American Pathologists. They're the ones whose regulations I'm most familiar, or not regulations, accreditation requirements I'm most familiar with. Our laboratories also has a accreditation by AABB for our blood center, and ASHI, who certifies our histocompatibility laboratory. So laboratories can have certificates of accreditation from multiple organizations that would focus maybe on some of their subspecialty areas. I think CAP has a very robust laboratory accreditation program. Again, I'm biased because our labs are CAP accredited, and as on my disclosure, I'm also a member of the CAP microbiology committee. I have worked in a laboratory that was accredited by the Joint Commission in the past. I find that I found CAP accreditation to be in my opinion, slightly better than Joint Commission, but that's just my opinion. Ultimately, they're all approved by CMS to offer laboratory accreditation programs. So they're all at least meeting that minimum standard. I think maybe maybe it's smaller hospitals or laboratories might have Joint Commission accreditation with their lab in conjunction with maybe their hospital accreditation. But CAP accredits laboratories of all sizes, shapes, and across the world, not just in the United States.
So the next question we have is, do I need a license to begin to practice in Georgia? So that is, I believe, a state-specific requirement, right?
Let's go back to my list just to make sure.
Yes.
It's not memorized. But Georgia is not a licensure state currently. I don't know if there are plans, if there's legislation under consideration, but this was a list current as of like last week. And it's not easy to just add a licensure law on the books in a state. That's not an easy process. But no, these are the 10 states in Puerto Rico that in the United States do require licensure.
Let me see if there's any additional question. So one question we have here is a comment, a question here. So the comment is well, excellent talk, Nicholas. If I'm understanding it correctly, for earning certification, will one have trouble if they completed their bachelor's in a qualifying degree more than 5 years ago, but have earned a master's degree within the past 5 years? So I hope this question makes sense.
So would one have a problem if they're undergraduate degree was more than 5 years, but then subsequently they earned a master's degree. Did I hear it correctly?
That's what it sounds like.
So I think I think that is a great question, and I think for regardless of the certification agency that you're potentially wanting to look at, these agencies, you can always contact them directly and speak to someone, because I would hate to give out incorrect information to someone. So I would encourage whoever asked that question to reach out to that certification agency directly, and hear from them. Because you don't want to probably submit your application and pay whatever the application fee is only to find that it's rejected. That would be horrible, because these are not inexpensive applications to submit, of course.
Right, and also to sit for a certain exam, that's a lengthy process to prepare. So yeah,
absolutely.
Let's see, any additional question do we have? There's one question here directly to me. So if would you foresee the regulatory or accrediting agencies will enforce the certification requirements for the laboratory personnel, and how will it impact the workforce demand?
Well, that's a great question. I think we can all, it can be, I think personally, this is again my personal opinion, I think certification is important for clinical laboratory personnel. It demonstrates a knowledge and understanding of not only the testing process, but disease process, a little bit of pathophysiology. What are the things that can impact or make laboratory results, falsely positive, negative, increased, decreased, and so forth. So I think it's really important, and you get that by going through an accredited training program. I think that it's an area of debate, though, because I'm sure there'd be a lot of pushback from certain industries or lobbying groups who would want to fight additional layers of regulation when it comes to personnel. Especially when there's a laboratory workforce shortage. I don't think, but I think we all have to remember, and again, this is my opinion, we're all here for a reason to in clinical labs to help provide care for patients in a healthcare setting, to provide reliable and accurate results. I think education and training are really important for that. I don't think it's an area where you want to compromise with respect to personnel requirements. I don't foresee in the immediate future CLIA being rewritten to mandate certification. I don't think it's a bad idea. I would much rather see licensure more required across more states. But that's, again, another hurdle to have to overcome on a state-by-state level.
Very thorough explanation. Thank you. Righty. So I'm not seeing any additional questions here. So I guess that's pretty much it. And thank you so much, Dr. Moore, again for an excellent presentation and addressing all the questions. And so this concludes today's program. And a recording for today's event will be available on ASM website on YouTube within 1 week. We hope you will enjoy us on October 12th for our next webinar, exploring behind the curtain of the clinical microbiology laboratory. Thank you and bye.
Thank you.